So the IMNI project, which IMNI word comes from a Persian language, and looking at our experience of working in these super high risk union councils over time, what we have looked at, how can we redesign immunization systems, and how can we redefine or redraw our relationship with the communities, especially Pashtun communities and mobile and migrant communities. So in this project, we are proposing a sequential design where we will be co-designing interventions. So using human-centered design, we will design this project in a way that is context specific and addressing the needs of the Pashto speaking communities and mobile and migrant populations living in all these SHRUCs. So what is our approach? What we are proposing? We are proposing innovations that are specific to the context, and those are looking at the culture, socio-economic situation. So this will be a kind of a combination of demand and supply interventions, which will of course improve not only uptake of the immunization but their trust in the system. So we would integrate immunization into existing services within the maternal, newborn and child health services. So not looking at EPI as isolated services but as integrated part of whole health system. In addition to this, I would also like to highlight the way we would evaluate or assess the interventions to see how these interventions are working in achieving the outcome. So we are not looking at the data on at the impact level, but as this project is proof of principle, so our theory of change we have designed in a way that mainly looks at the outcomes, behaviors, trust level, and all those key elements. And specifically, we are looking at the mechanism, the actions in the theory of change, that how our inputs will translate into the outputs, and from outputs how they translate into the outcomes. So this is how we have designed, and we are very much interested to work with our partners, Impetus and Path, to work collaboratively and test these innovations.
Hi everyone, this is Temur. I'm excited to be part of a consortium that's applying in response to the RFP that was floated by the Gates Foundation. This is a very interesting opportunity for us to be part of for two reasons. The first being that we've done a lot of work in Karachi in trying to understand what are the reasons for vaccine hesitancy, how can service experience be improved, and how can service quality respond better to the needs of caregivers. But this is the first attempt to formally structure and design an iterative approach that actually allows us to test, deploy, scale, and rejig interventions, work packages that can truly improve service quality and service experience. The second thing about this that is personally very attractive for us is the fact that we are looking at innovative, unconventional approaches that haven't been tested in the past, but we would like to see, can they work in Karachi and can they work in the context of the SHRUCs and the high-risk union councils. So it's a bold initiative. It requires us to think big. It requires us to be ambitious, but we're confident that what we proposed is truly the answer to the challenges that Karachi has seen. And we hope that what we can deliver through this initiative becomes an example for other high-risk communities in Pakistan. Thank you.
Hello, I'm Dr. Arshad Chandio, Country Advisor for Pakistan at PATH. PATH is an international NGO working for advancing health equity through innovations, partnerships, health system strengthening, digital health, medical technologies, vaccine development and access, policy, advocacy, and beyond. On behalf of our global and local experts, we look forward to the joint expression of interest submission and engaging with AKU and Impetus to work on this Gates opportunity together. PATH will be providing a journal oversight role, contributing to the artificial intelligence and gender elements as well as interpersonal communication for this initiative, should we be invited to the RFP stage. PATH is committed to support the efforts to strengthen service quality and improve caregivers' experience in the super high risk union councils of Karachi. Thank you.
Hello, I'm Dr. Varda Ahmed from Khan University. In the end, I really appreciate to you for listening to us and exploring about this transformative initiative. As we heard from Dr. Zahid's comprehensive project overview, Dr. Taimur's insight on the importance of local yet innovative approaches, and Dr. Arshad's perspective on connection of global and local immunization services. We all believe that gender is not afterthought, but a core element in decision making and planning, acknowledging that women, men, girls, boys, and every individual experience things differently due to social norms, access to care, and power structures, especially in these high risk union councils in Pakistan. This 24-month proof of principle investment isn't just about improving vaccination rates. It's about rebuilding trust through human centered approaches and understanding the behavioral and social drivers. Built on our previous project, we will not just address service delivery gaps, but we aim to redesign service delivery, which is scalable and sustainable, that transform how marginalized communities experience healthcare. Here, I am proud to highlight Dr. Mara Ali from Khan University and Ms. Hania Kavi from Impetus, whose expertise shapes our evidence-based framework in this proposal. And they are leading implementation projects on the crucial Karachi immunization work on the ground. Together, as a team, we will generate learnings to connect community and systems across Sindh and beyond Pakistan. Thank you for your attention.